Well, hello there, and welcome to another edition of Johnny Davis Live. We're here for our new series of great conversations about, serious issues and maybe not so serious issues sometimes, about all the things that are going on perhaps, but more so about good things that are going to help change people's lives. And I think nothing can be more serious than what we're going to be talking about today, colon cancer. As we know, in the past, last week, we lost the great actor, Mr. Chadwick Boseman, and to colon cancer. And so I started thinking about what kind of show I wanted to do to start off the new series, and it just kind of came to me. And then I kind of saw where Miss Christy Fix had put a post up about some things that had gone on in her family. And so I thought to reach out to her and bring her on, and she agreed. So I'm so happy that she's going to do that today. She's out of Summersville, South Carolina. And also we'll be speaking with the one and the only Dr. Jon Lucas, who is just someone who just knows something about a little bit about everything, in my opinion. He's so knowledgeable and so grounded. And it's always a pleasure to have him on the show. The show will go probably a little bit over an hour today. Just depends on how long-winded I decide to get. But we will make sure that we kind of are in detail and talk about this serious issue of colon cancer and how we can perhaps prevent it. And certainly that, some things we can do if indeed it happens to us. Perhaps Miss Christie and Dr. Lucas can give us some interesting perspectives on that as well. I want to always thank our sponsors, Wearawig.Club. At Wearawig.Club is where we have some interesting wigs. Well, a lot of people wear wigs, all styles, all colors. Please check them out. They're going to be helping us out with the show here going forward. So please check out the website if you know people are interested in wigs. And also Eastern Offset Printing. They do all of our print work for us. They're out of Atlantic Beach, North Carolina. We certainly thank them for all they do. As you know, guys, coming up, we have the IKF East Coast Classic that's coming up in Myrtle Beach, South Carolina. It's going to be a great event, October 9th and 10th. Registration is in progress at akpromotions.org. You definitely want to check that out. COVID-19 protocols will be in place. So if you are, planning on coming, be sure that you're planning and willing to do the protocols, which wearing a mask is mandatory for spectators, is mandatory for everybody in the building, temperature checks, etc. But we'll talk about that at another time and on another show. As always, I want to give my sincere condolences to all of those who may have lost someone during this COVID-19 crisis. We hope that you will be safe. But for right now, guys, we're really asking everyone to wear a mask. Be sure to like us on our AK Promotions page and YouTube channel, right? We're trying to build up the audience there. Please be sure to subscribe to our YouTube channel at also Johnny Davis Live. A lot of this information that we do on Facebook will be uploaded to YouTube as well. So we're so thankful for everybody's support. Okay, so we want to go ahead now and get into our conversation with Miss Christy Fix. We want to bring her up and everything. I have her hiding down there in my lobby, right? A great lady, someone who is a mother, a wife, right? And also practices Muay Thai. Believe it or not, ladies and gentlemen, let's bring up the one and the only Miss Christy Fix. Hello there. How are you?
I'm very well. Thank you, Johnny. I appreciate you having me here today to discuss this important topic. So.
Yeah, it's such a serious thing, and I'm so honored to have you on to share your story, because I think a lot of people don't really get it. A lot of people don't really understand about the importance and maybe the things that people go through with this disease. We talk about Mr. Chadwick Boseman, and I noticed you put something on your website about that too, and that's what kind of caught my attention. And but quickly, I just want to say about him, someone who played a great actor, played in great movies. He did The 42, which I just saw the other night, right? And it was like with Jackie Robinson. It was amazing. It was an amazing movie. He's an amazing actor. Of course, we know about Black Panther, great movie. Everyone saw that. But while he was filming some of these things, apparently, at least I don't know about Black Panther, but apparently in some of those movies, he was going through these, therapies and chemo and things like that. And I'm just kind of wondering about The Fighter Within. That's a series that I have. with my shows about what one must go through when they're going through such agony, but not talking about it. How hard is that? I mean, with your family in particular, when you're going to tell me a little bit about that, but I just kind of want to know off the bat, how hard was that to to go through,
Yeah.
knowing that with your own experience with it.
Yeah. And so, Johnny, I've thought a lot about that. And so, I've heard many people on social media actually give him a hard time about, wow, he had such a great opportunity to get the message out there and, why he didn't do that. And so, what I've learned through this is everyone's journey is unique.
Mm-hmm.
He's fighting for his life. And so, you're focused on your family and just surviving. And so I think as a celebrity, trying to add on top of that the responsibility of managing everyone else's expectations of how you should
Mm-hmm.
do that is probably too big of a burden, is my own personal opinion. And so, where I've been very open, I'm not a celebrity. I'm not, criticized in the national spotlight as he is. And so that probably is quite overwhelming to go through.
Yeah, but I think that again, you don't really have to be a celebrity to feel the anguish and the pain, and the things that that he probably experienced and all. Tell us a little bit about you, Christy, and just kind of give me an idea who Christy Fix is and about your family life, and then we're going to kind of walk you through a series of some questions here.
Okay.
Tell us a little bit about who you are and about your family.
Yeah, of course. So, as you had mentioned, wife, mother, executive, work for a phenomenal global company who's been very
Mm,
active through this scenario. And then, of course, also working very closely with my team at Charleston Muay Thai, both teaching and training. And,
mhm.
just Muay Thai in and of itself has been life changing for me personally. Lost approximately 80 pounds and just
Wow.
totally different perspective on life. And so having the opportunity to train in Thailand and really experience the culture has been just amazing, truly amazing.
Wow. 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 Yeah, we got to do a picture up there of your Louis Thai family there. Right. What do you think about the Jeff Grady guy?
Oh my God. He's like the son that I've never had. So truly nothing but respect and admiration for him and what he does.
Tell me a little bit about how you were introduced to colon cancer.
Yeah, so I'll kind of take a step back and share a little bit about my husband. So,
Mhm.
very active guy. Certainly, someone if anyone is in need, he's kind of the go-to. If you're moving on a third floor apartment, he's
Mm.
not say, "Oh, that's horrible." He's gonna, the type to say, "What time do you need me there?" And so, phenomenal guy. We've been married for 23 years, and
Wow.
about every day, he makes me laugh and supports my crazy ideas.
Right.
For it. So phenomenal guy. And so last spring, regrettably, we had his mother pass away pretty quickly.
Mm.
And so the stress of that, as you can imagine, wow, it's pretty
I'm
huge.
sorry to hear that.
Yeah, yeah. And so, shortly thereafter, he had some just red blood in his stool. And, the great wife that I am just said, oh my gosh, honey, don't worry about it. You're super stressed. It kind of went away. And then several weeks later, it came back again. And so, of course, that's not normal. And so he did the prudent thing, went to his doctor, explained what was going on. And the
Mhm.
physician said, okay, it's red blood. And so there is and I'm sure Dr. Lucas will kind of talk about this a bit, but with the red blood, it's, kind of lower in the intestinal tract. They probably said it's an internal hemorrhoid, not a big deal. They did an exam. It still continued. And so,
Mm.
his prudence, he went to another doctor, did the same exam, and they came back and said the same thing. Don't worry about it. You're a young, healthy guy. Don't worry.
So
And
it wasn't the first time it was he didn't get it on the first time, second time they didn't get it.
still, and so
Mm.
thank goodness he listened to his intuition and was an advocate for his own health. And really demanded. I know I'm not of the appropriate age for a colonoscopy, but
Mm.
I really do feel like something is wrong. And so, of course,
Talk, Excuse me. How old is he, by the way?
So he's 47 at that
47. Okay.
7. And so most people think that colon cancer is an old man's disease, if you will.
Mm,
I don't even have to worry about this until I'm 50. And then it's long thereafter that you have to worry. And we're seeing, like Chadwick Boseman, younger and younger people and women diagnosed with this just horrible disease.
mm.
And so, his surgeon came out of that colonoscopy and said, "Wow, you probably just saved your own life."
Wow.
Right, and right above where they would have done a digital exam, if you will,
Hmm.
there was a golf ball size tumor. And so we, of course, from there, you knew you had an issue. And so we did CTs, MRIs, all of those things. And the,
Well, let me interject there, Christy, if I could, just for a moment. So, had you had anyone in your family before that dealt with cancer?
his mother had passed of cancer, but a different kind of cancer.
Hmm.
So there weren't really any, screaming alarm bells of colon cancer within his family history.
So I just want to kind of get the mindset of what that must have been like.
Hmm.
When were you there when he got the news?
I was,
You were there. So take us into that room
yeah.
when the doctor is explaining to you about cancer and how that must feel or must have felt that now you've heard about it, you know, this fear, and how it must have felt coming in and like really intimately into your family like that.
Yeah, it was quite alarming. I think my husband had already mentally prepared himself, because again, trusting his gut, something's wrong. And so had done
Mm-hmm.
research on his own, where I really was kind of focused on work and training and everything that was going on.
Mm-hmm.
It was quite devastating and shocking to kind of process, if you will. And so from there went into the mindset of hopefully it's stage one. And if you can identify colon cancer at a stage one, it's relatively easy to go in if it's in the colon and you have 6 feet of intestines. And so you can take out margins around it and still
Mm-hmm.
put everything back together and hopefully function, probably very well and move forward from it pretty easily.
Mm-hmm.
As we went through, however, and did all of those tests, I mentally set myself up for, okay, we're going to have surgery and we're going to, do.
Right.
So that appointment that we had was something very different. And so it had, they identified it was at the top of his rectum and into the colon. And so
Mm-hmm.
the position of it was less than ideal from a surgical perspective. And it had already gone through the soft tissue and into the lymph nodes. And so, for those that aren't familiar, I consider that somewhat the Uber, if you will, of spreading things. And so,
Yeah. Let
um,
me.
immediately went from a stage one to a stage three.
Okay, so really quick, and I'm sorry, I'm going to keep interjecting here. Okay, kind of keep it going forward, but I'm just trying to get the feeling from your family too
Mhm.
that again it hit intimately home, but now you two adults know, but then there's now telling the kids.
Yes. Yeah.
What was that like?
Um, so we gave ourselves a few days to kind of wrap your brain around.
Mhm. So you didn't tell them right away.
No, no.
Mm.
You don't want to alarm people unnecessarily. And so, you think stage one, okay, we'll just have surgery, not a big deal. And then, whew, that was alarming news for sure. Um, I said I was going to keep it together.
I'm sorry.
So, anyway, so you move forward, right? March forward, like Johnny, you say all the time, right?
Fort March, yes.
Forward march. Thank you. Excuse me, I got it backwards. So you have that conversation. I think we both approached it very calmly, which helped them not like freak out about it.
Hmm.
In the same regard, you immediately go into, okay, you find this out, you want to hurry up and let's get treatment started. And so we assembled what I call the brain trust. So you have radiation physician,
Hmm.
doctor, as well as a surgeon. And so we really had a phenomenal brain trust that we assembled that put together a very aggressive plan.
Mm-hmm.
Kind of tying it back to Chadwick Boseman. I don't know what his plan was, and obviously very young, healthy man, and so I don't know his treatment, but to envision him having movies that he's making in between all of this is just blows my mind. It's
Right.
crazy. Um, so we started with the 8 weeks of radiation, and
Mm-hmm.
so that's on a daily basis. And so for both men and women, that's a very complicated area. You have a lot of
Right.
stuff down there. And so your bladder, there's a lot of risk that goes into kind of treating the stage 3 level. And so he did that daily for 8 weeks. And so there's nerve damage and all kinds of other things that come into play.
Christy, but
Yes.
right there, I kind of want to. I got to go back just a moment when you were talking about your children, but I want to say at the attitude of the family at that moment. Was it like doomsday, or was it like we're going to beat this thing? What was the attitude of your family?
This thing. And so my husband's attitude has always been incredibly positive. And so he's never had any doubt in his mind that he wouldn't,
Mm,
period. And
hmm
so, anywho, and so the kids, I have one that was going off to college. So we had to
mm,
accelerate the conversation because the very next few days she was starting school.
mm.
So we couldn't have her off. That's not a phone call that say, hey, by the way, your dad's going to have surgery. And so
Right.
we had those conversations. Our other daughter was in middle school. And so getting her to kind of understand that we're probably, it was coming into the start of her golf season. And so
hmm
we're probably not going to be able to make some of the matches that she had. And so both of our children have been incredibly supportive, very understanding, because it has had an impact on them as well, for sure.
Right, right, and I mean, I wonder about a child thinking about the fact that their dad might not be around
Yeah.
next week, next month, next year, see
Sure.
me in my wedding, walk me down the aisle, and things like that. I think that fear must have been a little overwhelming, but they seem to have handled it pretty well.
No, they have. They have indeed. And so we collective as a family remain very positive throughout. And so it's a horrible disease, a horrible treatment, but we still go back to, even though the road is hard, it is curable. And so that's where we choose to focus.
You mentioned about your family and the fact that you guys are still strong and still together. But how did it change the perspective? It seems to me that it would be some type of sense of urgency about
Mhm.
maybe doing your bucket list, or as a family or as a person when something like that hits. What was the family psychology on that?
So, sure, there's bucket lists and things that you think about, but those are later. And so right now it's just the here and now, the only way out to that.
Mm, mm.
And so let's, put the energy here and get it done. So
Wow. Well, go back to what you were saying. You were going through the treatments and the process.
sure.
Sorry, Christy.
Oh, no, 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 no.
Sorry to kind of take you there, but it's going to help a lot of people.
Yeah, yeah. So radiation was first. And so the
Mm,
intent radiation with pill form chemo at the same time. And so, that of course, is the effort is to shrink the tumor before surgery, and
mm,
incredibly responsive to that. And
mm,
whenever they did an exam pre-surgery, they even had to go and get the chart and make sure where was this tumor because it had shrunk to nearly not there. So you
mm,
couldn't for a better reaction to that. So then we go into after Christmas was surgery, and so they removed, part of the rectum and the
mm,
colon.
mm,
So because of the position of that, as you can imagine, you can't just open right back up for business. And so they had to shut down basically his lower intestines for about 3 months,
wow.
which then meant that he had what's called an ileotomy bag.
Mm,
And so basically, at the top of the intestines are now outside of the body, and you have a bag. And so it's
What did you call that? Is it a colostomy? What do you
um,
call it?
ileotomy.
Ileotomy.
Mhm.
Okay.
So,
Okay.
and with that, there's severe risk of dehydration because you're losing
Yeah. Yeah,
out
I've seen those. Yes.
water. And so we had to have an IV of fluids for a couple of weeks because your body
Mm.
that. As much as I, am not squeamish, I don't mind if I get a bloody nose, get a black eye, get punched in the face.
Right.
Um, I'm not a nurse. And so flushing IV lines and
Right.
packaging and changing bags and intestines pooping at you. And
Yeah.
I'll be
I am a little curious though about because I'm looking at his smiley face on the picture here. Were there mood swings? I mean, was he just kind of taking it like a feather? Was he just kind of like, "Hey, we're gonna go, blah hurrah"? I mean, was he? What was his mentality? Was he kind of up and down about it? I mean, if you want to share that, that might be too personal.
no, it's not. And that's why I told you going into this, let's have a real conversation. And
Yeah.
so the thing that's off limits. Um, and so he is a trooper. I mean, it's phenomenal. And they're um, very painful experiences in the restroom through
Yeah.
the process, not at the time that he had the ileotomy bag.
Mm.
Just with radiation, it's like liquid lava. I mean, it's awful. And so, we all hear him sometimes in the restroom.
Mm.
That's painful to hear. Um,
Mm.
but he never complains. So
Wow, that's great to have that type of attitude. How going through what you have already, and he is now um, what is the word? On
yeah,
remission?
no
In
evidence.
remission?
They don't say cured. They don't say in remission. So it's no evidence of disease is where we're at right now.
Okay. So where is your mind and maybe his about the maybe the fear or whatever about it possibly returning?
That's always a concern, and I'm
Mm.
sure we're still going through. We have 3 more rounds of
Mm.
chemo, and so we're kind of in the mop up phase, if you will. And so post surgery, once you get the green light, our approach has been very aggressive, and a lot of people don't do this last phase of mop up. And so after surgery, you could have a couple of cells that during that procedure kind of free radical go around
Right.
um, and they don't do this mop up scenario, which kind of
Right.
has a compounding effect. And um,
I'm kind of curious though about the fact that he's in chemo now. That means that he would have, I would say, a compromised immune system. That
and
would be my guess, right? Which would kind of, I guess, would qualify as one of those underlying medical conditions in regards to the COVID-19. So I'm a little curious about how that has affected, your activities and things that you can do and the family as a whole, and trying to keep him safe. Where are you on wearing a mask?
yeah, and so well, we wear masks for
Mhm.
sure,
Mhm.
and we don't. I'm not training right now, and so being around people at the gym and the risk of asymptomatic people, it's just this road has been really hard, and so the last thing I want to do is then have him get sick because of a stupid pandemic, and so this road's been too hard to risk that. And so we wear masks, and am very fortunate that my work has been very supportive of a remote work scenario,
Mm.
and so phenomenal. And we minimize our time. The grocery store. We make purposeful trips and don't go out so much.
Right.
And from a family impact, my oldest daughter is in college, and so she's off living her best life as
Right.
I want her to do.
Rest.
My husband wants her to do. And I think probably the hardest has been our 14-year-old now going into high school,
Mm.
and not around her friends as much as I'm sure she would want to do. And so she's been such a trooper and has literally never complained, not one time.
Wow. Nice.
So
So when you talk about and this kind of not politics, not getting into that, but say this again, maybe in another way, about the importance of wearing that mask, if not for yourself, for others.
sure. And so I know a lot of people, and I have no fault. It is a personal decision, and If people don't wear masks, that is up to them. And so, but it is ultimately, I think, my responsibility and our family's responsibility, knowing that we have an immune compromised person, to be prudent and have our due diligence. I'm not mad at anyone for their position. In fact, if you want to kind of flip the script a little bit, I actually am somewhat grateful for this pandemic because if nothing, there's a heightened awareness of health and just washing your hands and those types of
Yes.
that was not there. I probably am going to be the crazy lady chasing everyone with Lysol.
Right, right, right.
A little bit better in that regard, as much as it is very difficult, as I can only imagine for my youngest. We play a lot of games at Uno together, and as a family, we've much, much closer, which is wonderful. And so I don't think the pandemic has necessarily been a bad thing because
Right.
we do have to go out. People are being more prudent than they ever have been.
So tell me, though, as we start to wind down here, Christy, what are the things that you're most grateful for as you see your husband and you see your children and you guys are still here and you're still together, unlike, unfortunately, Mr. Bozeman's family? What are some of the things that you're most grateful for in catching this earlier now?
Yeah, no, and not every day is good, but there's good in every day. And so I think it is,
Very good.
change perspectives of what you worry about. And so that's good. Um, anyway,
No, I mean, that's a big one. That's a big one. So if your husband was sitting in front of you right this minute, what would you tell him? He's going to see this if he's not watching it.
I know he probably is.
Yeah,
No, keep on. There's no quit.
right, right. And I know that is an important part of this whole conversation is the fact that catching it early.
Yes,
And
definitely.
so let's talk a little bit about the screening and how important that was, and what would be your best advice to everyone out there right now.
Yeah, and so my husband and I, we actually had multiple conversations kind of coming into this because I wanted to make sure that he was okay
Right.
by sharing his information. And so, collectively, what do we want people to kind of walk away from this discussion today? And so,
Mhm.
a couple of things. So, one is around the awareness that this is not an old man's disease.
Right.
And so, it impacts younger and younger people, including women as well. Evidenced by Chadwick Boseman, people who are, truly elite athletes and very healthy
Mhm.
is immune from this scenario.
Right.
Secondly, the importance of not ignoring symptoms. And so, if you have blood in your stool, that's not normal. And so go to a doctor. Um, in the same regard, trust your gut and your intuition.
Right.
Nothing stronger and better than that. And so I'm very grateful that my husband did that. To have two doctors tell you, don't worry about it. A lot of people
Mhm.
very easily walk away and say, like, whew, dodged a bullet on that one.
Right.
Had he not been that determined, I have no doubt he would have the same fate as Chadwick. And so we both are very grateful for that. And then I think last but not least is to have open conversations like we're having today. And
Yes.
literally, I think of many of your viewers are young, in their 20s,
Yeah.
fighters, really healthy, and don't think that this, maybe applies to them, and maybe it doesn't yet. But it probably does to their parents and their grandparents. And so
Mhm.
educate yourself, talk shit with your parents,
Yeah.
do what's going on and really have open dialogue. And so I'm very grateful that you gave me the opportunity today. So
Well, I'm very grateful that you shared your story with us here today. I think, again, it's going to help out a lot of people. Before you leave, though, I want to go ahead and bring up our next guest, Dr. Jon Lucas, to kind of get his perspective and maybe on what you went through. Dr. Lucas, sir, thanks so much for being on today.
Glad to be on again.
You heard Christy's story there. What are your thoughts about her story?
Well, I appreciate you sharing that because it's really important for people to hear. And like you said, especially younger people, because I'm sure that if you were to poll people in their 20s and 30s and probably even their 40s and ask them about colon cancer, they'd say, yeah, that's real important for my parents and grandparents, because
Right.
people think of colon cancer as being a disease that strikes in the, sixth, seventh, and eighth decade of life, and unfortunately, that's not entirely true.
Right, right, right. So, Christy, thank you so much for being on today. We certainly appreciate you. And the story, again, is just, it's kind of heart wrenching, but at the same time, there's success on the other side, right? There's hope. So sometimes you got to go through tough times to get to the victory. And I'm so glad you shared that with us today. And we'll talk to you again real soon.
Thank you.
All right. To your family. Thank you. Bye bye. All right, ladies and gentlemen, who was speaking there with Miss Christy Fitch. She's out of Summersville. Had a very interesting story there about colon cancer and how it affected her family, her husband. But today he's moving forward, and that's a very good thing. Now we have the one and the only Dr. Jon Lucas, a man who knows a little bit of it all, one of the most knowledgeable people that I know. I'm telling you the truth. And I know some knowledgeable people. You know why, Dr. Lucas? Because I look in the mirror every morning. And I'm also a comedian. Then I woke up, right? Right. But Dr. Lucas, in hearing her story, obviously colon cancer is such a serious thing and something that we certainly need to, I think the more information that we get out, the better for people if they would heed that information. But my first question to you is, because when I hear about colon cancer as a man in particular, I think about prostate cancer. So I'm trying to think, other than being different organs, kind of what is the difference in that, or are they kind of the same?
So, I mean, they are different organs. So they're related in that they both tend to strike people at about the same age group. It tends to be older patients in general. Prostate cancer obviously only happens in men, since only men have a prostate. But the actual biochemistry of the tumors and everything like that is completely separate. They're different tissue types. The type of tumors they get, the area in which they occur, and therefore the tissues they extend into, and the consequence of the tumors, and then how they're looked for and how they're treated are different, because they're different organs.
One of the things she mentioned something about, her bowel, the changes in the bowel and using the bathroom and things like that. Can you kind of elaborate a little bit more on what that change in bowel habits that we're looking for, and what kind of should be the normality, and what is the difference?
Yeah, so I mean, basically, just like with any other symptom that you have or any other normal functions you have, if you notice a significant change in the way your body's working, it heeds attention. It would be a good idea to pay attention to that and try to figure out, why is this going on? And if there's a simple answer, then great. But if there's not a simple answer, then you need to talk with your physician and look into it further. So the big red flag, as she mentioned, was blood in the stool. You're not supposed to have blood in your stool. Had her husband's cancer been a little higher up in the GI tract, and he had the more stereotypical black tarry stool of blood that's gone through the GI tract and been metabolized a little bit, they probably would have jumped on his symptoms a lot faster. But the bright red blood in your stool, especially in somebody who, I mean, he's basically my age, somebody who's in their 40s, is not usually a sign of colon cancer. It's usually something, just like she said, it's like a rectal fissure or internal hemorrhoid or something like that. So, but it's still not normal. If you're using the restroom and you notice that there's blood in your stool, be it bright red blood or the sort of black tarry coffee ground looking kind of processed blood, that's not supposed to be there, and that bears looking into to figure out what's going on. And it could be something as simple as an ulcer or a hemorrhoid that's bleeding, something like that, or it could be something worse. But you want to know the answer as to what it is, not just ignore it and hope that it goes away.
Okay, that's good information. They also talk about abdominal pain or something like that, I guess, on a persistent, consistent level. I mean, that is different, I guess, than having gas or something, right? So what are we looking at there?
Yeah, so the same thing. If you're having unexplained abdominal pain, especially severe crampy abdominal pain that there's no obvious reason for, and it's happening more than on a single occasion, if you're having issues with constipation or diarrhea, there's any other significant change in your bowels, you need to start searching for a reason for that. And again, it could be something simple. If you totally changed your diet, and you normally eat a balanced diet, now you're on a burrito a day diet, and you start having increased gas and diarrhea. It could be because you have way more fiber in your diet. But if you
Mm-hmm.
don't have an obvious reason why there would be a significant change in your stools, and you're noticing that there's a significant change in your stools, or especially if you're having abdominal pain, especially severe abdominal pain, you need to get that looked into to see what's going on. It's important to mention whenever we talk about cancer, all the signs and symptoms we talk about are signs and symptoms of cancer, but they can also be signs and symptoms of other things. So just because you're having abdominal pain doesn't mean you have cancer. So and the reason why I bring that up is some people worry,
Right.
they would rather not know. So they're like, well, I'm not going to get this looked into, but you could be, preventing yourself from finding out that you've got a dysfunctional gallbladder that could be easily fixed, or you've got ulcerative colitis or something else that you would want to know about, but isn't necessarily, not necessarily the big C word that everybody worries about.
Right, right. It talks in some of the symptoms as well about the feeling of not completely emptying your bowel when you're using the bathroom. And I mean, I guess it's a kind of the glass that's half full, half empty type thing. I mean, what are we looking for there? I mean, how do you know if it's complete?
So it's basically by feeling, and you really would have to talk to somebody who's had that particular symptom to get a real good idea of that. But I mean, the kind of feeling of like lower abdominal pressure you get when you have to make a bowel movement.
Mm,
And then if you go to the bathroom, you would expect to not feel like you have to make a bowel movement again. And the people that are having issues with not emptying their bowel completely, they'll use the restroom, but still feel like they have to go. And sometimes you can actually see a difference in the shape or the texture of the stool. I have a German Shepherd that died a number of years ago from
mm,
colon cancer, and
oh,
we figured out he had colon cancer because he started having stools that were literally shaped like a letter C. There was clearly something, like there was a tube, but it was like if you imagine the Play-Doh machine, where you push the lever and the
yeah,
Play-Doh
yeah,
comes out of
yeah,
the
yeah.
machine. If you had one of those that was making like a U or C shaped, that's what his stool looked like. There was a mass in his rectum that was making the stool be abnormally shaped. And obviously he couldn't tell me that he felt like he had to poop after he pooped, but you could tell he would go to the bathroom,
Right.
come back inside, and 5 minutes later he's back at the door. Part of that is probably the space filling aspect of the lesion, and part of it is that he just can't expel all of the stool that's there.
Right, right. Well, I'm sorry for your loss with you. He's gone now, right?
Yeah, and this was unfortunately years ago. It was 12
Yeah.
years ago. Yeah.
Yeah, but you know what? I lost a dog like that as well. And trust me, it hits hard. People, that's why when people put stories on Facebook about them losing a pet, when I put that sad face or whatever, I'm really feeling it. I mean, it's a real feeling, no
Yeah.
doubt. When they talk about weakness and fatigue and things like that, is where's that coming from? Is it just how is that taking your strength away, your energy away?
So I don't think that there's an easy answer to that. And
Mm,
unfortunately, with the list of questions, we're probably going to go through the easiest answer to all the questions is we don't really know.
right.
But any major disease makes your body work harder because it's trying to kind of
Mm,
do something about the disease. So that happens when you get a major illness. You
right.
like like a cold or the flu or coronavirus or whatever. Your immune system's going in overdrive, and your body's focusing a lot of its energy on that, so you don't have as much energy left over to do the things that you want to do. And then especially cancers of the GI tract, there's sort of a double whammy effect. Is not only is your body trying to deal with the fact that you have this cancer, but a lot of times colon cancers, especially cancers that are higher up in the GI tract, they can affect
Hmm.
your body's ability to absorb certain things, so you might not be getting the nutrients that you need. And we mentioned blood in the stool as a symptom. So a lot of people that have cancers end up being anemic. Their blood counts are low, and they feel tired because of that as well. So there's a number of different reasons that could account for that. So that's one of the symptoms that you should always talk to your doctor about. You and I are both just like everybody else. Every year we get a little bit older, so some of
Yeah.
the things I used to be able to do real easily, I can't do now.
Right.
But if you find yourself trying to do something that you have recently been able to do, your workouts are getting progressively harder and harder at a relatively fast pace, or
Right.
you just, even though you're getting good night's sleep and there's not any clear reason why you'd be tired, you always feel like you're dragging. You get home from work, you need to take a nap, and something's different. You know that something is different. You kind of get that, that voice in the back of your head saying, hey, there
Right.
might be something going on. You got to listen to that voice and get it checked out.
Are you kind of hinting around to how tired I'm looking on my videos when I'm doing the training tips? I mean, are you
Oh,
trying to say that I might have some issues going on already, Dr. Lucas, or what?
yeah, no, that was not meant to be personal towards you, but I mean, have the same thing. Have workouts that I, used to do without thinking about
Right.
it,
Right.
circuits and things like that. And now it's a much bigger deal, and that's just getting older. But the biggest is a sudden change that seems out of proportion to, changes in age, or having been sedentary. If you think your problem is that you haven't worked out for 6 months because of the pandemic, but
Mhm.
you're 2 or 3 weeks into your workouts and they're getting worse and not better, then something might be wrong.
Well, I think one of the things that you kind of alluded to, if you're talking about your intestines and things like that, it certainly is going to affect your appetite, right? And also kind of maybe give us a little example of how that is going to affect your eating habits, or not even feeling like you want anything to eat.
Yeah, so I think anorexia is probably one of the more common things
Mm.
that people get with GI tract
Oh,
cancer. Is they get a feeling of fullness, so they don't want to eat, and therefore they end up losing a lot of weight. And in retrospect, that's one of the things. There was some very mean-spirited memes about Mr. Bozeman that have been
yeah,
circulating the past couple of months, predicated mostly on his weight loss.
right.
And almost certainly that weight loss was because of him battling cancer. And one of the things that a lot of people with colon cancers don't feel like doing is eating. Some of it is a direct effect of the cancer. A lot of the cancer treatments, especially radiation and chemotherapy, can
Mm.
make eating painful, can cause problems with your esophagus, and just the feeling of sickness and tiredness that comes along that makes people not want to eat. So that's again a symptom that you need to take seriously. If you're not feeling hungry, or you have a sense of fullness despite the fact that you haven't been eating normally, and you're starting to lose weight, that needs to be looked into, because something is going on. Again, doesn't mean you have cancer, but that's not normal.
Well, pretty much all the things you've said are kind of signs of when you need to possibly see a doctor, right? I think that is just the information is really important. But we're going to go into now a couple of the risk factors, those things that maybe just because of your makeup, things you may do or may not do, right, that can also maybe enhance your chances of cancer. And one of those is age. Tell us how that plays into potentially getting colon cancer.
So, a lot of the risk factors are things that we know are associated with cancer, but we might not necessarily know exactly how they cause, or what the interplay between the specific risk factor and cancer is. But age it's literally just a matter of being around longer, and the cells having had more time to divide. It's more likely, the longer that a cell has been around and the more times that it's divided, that something will go amiss and it will become cancerous. Because these cancer cells are normal body cells that have a change occur in them, and
Right.
the body basically loses control over them. So the longer you've been around, the more you've been exposed to things that would make it more likely that change would occur. And the more cell divisions that a particular tissue has been through, the more likely those things are to happen, and make that switch into a cancerous
Now,
state.
you and I have had many conversations about a lot of things. We talked about diabetes. We talked about the COVID. We talked about obesity. We've talked about so many things, right? But it
Mhm.
seems like the same thing keeps coming back around is why does colon cancer seem to affect African American people more than others?
Yeah, so that's a great question, and there really, again, I don't think that there's a simple answer to that. In the United States, one of the reasons that's been postulated, and is almost certainly the case, is it probably has to do with in broad strokes, the general socioeconomic class. So
Mm,
people who have less access to health care are going to be more likely to be affected at further along states when their condition is discovered. Because if you're getting regular checkups and you go to the doctor real quickly when you get a symptom, things are more likely to be picked up earlier than if you wait until there's a significant, something you just can't, you're losing weight, you've had blood in your stool for a couple of weeks and you can't eat and you're tired all the time, and finally you're like, I need to go to the doctor, versus the person who goes to the doctor and starts getting checked as soon as they see that they've had a little blood in their stool or something feels a little bit different. And then in addition to the socioeconomic and access issues,
Mm-hmm.
there's pretty good evidence that there's probably a genetic predilection in African Americans to have colon cancer earlier, to the point where some health experts have advocated, Cindy mentioned that people generally start getting screened for colon cancer at 50. There's a push in the GI world
Right.
to start that at 45 for African Americans, because
Mm-hmm.
they're more likely to have colon cancer
So we're
at a
talking about
younger
social
age.
economics, and we're talking about maybe just the tendencies. If you have a socioeconomic issue, then you might not go to the doctor as much. So is that it, or is it maybe something in our DNA? Is it like melanin or something that somehow is stronger that causes this cancer early in so many of us?
So it's probably, the answer is probably both.
Mm.
It's funny you mentioned melanin, because one of the risk factors for colon cancer is vitamin D deficiency.
Mm-hmm.
And one thing that's been postulated, and this wouldn't explain the increased incidence seen in African Americans in the United States,
Right.
but it might be a contributing factor, is
Mm.
that the African American community in the United States, particularly in the northern United States, is way more likely to be vitamin D deficiency than the Caucasian population. I mean, the whole reason why we're Caucasian is we stopped making as much melanin because we sort of evolved to live in areas where the sun's not as strong. The white
Exactly.
skin is intended to be a skylight to let in more sunlight so that you can get more vitamin D. That, and
Mm.
vitamin D is important enough that sort of a major change happened evolutionarily. So I mean, if you lived in, I'm from New York, if you lived in upstate New York, where if you have a normal 9 to 5 job, you have no chance of seeing the sun
Yeah.
for 6 months out of the year.
Right.
You're going to be vitamin D deficient unless you're supplementing. There's just no way around that.
So how
So
about really quick, associated with sun tanning? And, obviously we don't need the suntan, but white people need the suntan. I don't know if they need to, or,
I can say, yeah, I was going to stop that. We definitely do not need to
right, okay,
suntan per se,
okay,
but everybody needs some sort of exposure to the sun. But that does
okay,
not include, going out and laying with, your Speedo on outside for 4 or 5 hours at a time on the beach. It greatly increases your risk for other types of skin cancers and things like that. But getting
right,
some
okay.
sort of exposure to the sun just by, being outside, but even wearing sunblock and things like that, you don't need very much sun exposure to make the vitamin D that you need, but you do need to have some sun exposure.
Makes sense. So when we talk about personal history and things like that, so the chances of a person, if the person's had colon cancer, the chances are increased about maybe getting it again, correct?
For sure, yeah. In the individual person, if you've had colon cancer
Right,
once, your risk of recurrence, and I don't know the exact statistic, I'm sure
sure.
it's out there, but it's dramatically higher than somebody who hasn't had it, both in the reactivation of cancer in the area that you had it before. So like Cindy was saying, literally missing a little bit of the tumor when you're doing surgery and radiation and things like that.
Mm.
Sometimes some cells sort of squirrel themselves away and manage to miss out on getting taken care of by the treatment and then re-exacerbate, or having a polyp someplace else in your colon
Mm.
that wasn't the same as the primary site, but whatever it was that led to the cancer in the primary site could also be going on somewhere else.
When we talk about family history, she had mentioned, Christy earlier had mentioned something about, the fact that the mom had died from another type of cancer. Is that somehow associated, perhaps, that maybe in another body that it just caused another kind of cancer? How does that work?
So it depends. There are some genetic abnormalities that increase your risk to multiple different types of cancer.
Mm-hmm.
And then there's some genetic abnormalities that increase your risk to a very specific type of cancer. So there's some genes that we know that drastically increase your risk of breast cancer. There's some genes that increase your risk of colon cancer.
Mm-hmm.
And then there's probably more to it than that we haven't discovered yet.
Right.
But it's definitely the case that people that have a family history of colon cancer, so, multiple family members, especially if they're a first degree relative, mom, dad, brother, sister, or child that has colon cancer, then your personal risk of colon cancer is higher than the general population.
Awesome. I just want to remind everyone you're watching Johnny Davis live here, Real Talk, Real Solutions, here right now with Dr. Jon Lucas as we are discussing the disease of colon cancer. One of the things, too, that in kind of reading up on this, I noticed about diet. And they talk about the low fiber, high fat diet. It actually says Western diet. Are they talking about McDonald's? Are they talking about Burger King? What are they talking about there, Dr. Lucas?
Yes, I mean, when people say Western diet, they're basically just imagine your stereotypical American. So we're not talking about the person who's spending 5 days a week at the Muay Thai gym and following a vegan diet. We're talking about just Joe Blow, 45-year-old office worker, average dude that you think about, like is the backdrop character on a sitcom on TV.
Right.
That's the diet that they're eating is the typical Western diet, which typically is high in saturated fat, low in fiber. It's typically very high in calories and probably has more red meat and significantly more processed meats than you would see in the typical diet of,
While the red meats and the processed meats, does that have something to do with maybe how long or the type of digestion process?
It's unclear. The processed meats, it's probably nitrates in particular, but it's probably the chemicals that are in the meats. So processed meats, meaning like, luncheon meats, bacon, beef jerky, things like that, things that go through a significant process. When I say red meat, I mean just buying a piece of a cow and throwing it on the barbecue grill. That's, more red meat. There's not a lot of process involved.
Right, right.
In the processed meats, it's probably a combination of something about the proteins in the meat itself, and then more importantly, the chemicals that are used in processing it. Like I said, specifically nitrates seem like they may be a particular issue that increase your risk of colon cancer. And then as far as red meat itself, I'm not 100% sure. And I don't think it's really well known exactly what the issue is. Some of it may be within the cooking method. Some of it may be the protein itself. Some of it may just be simply that fiber is potentially protective. So if you eat a lot more red meat, you can only eat so much stuff. So if your diet is higher in red meat, it's probably going to be lower in fiber. It's probably going to be lower in essential oils and things like that than it would be someone who was eating more fish and grains and leafy greens.
Right, right. Well, I don't want to miss the point. I was going to slide by this question here, but about when you had already mentioned about the sedentary lifestyle. In other words, don't be lazy.
Yeah, and that's every disease process we've talked about. That's pretty much the answer. The human body is definitely not designed to sit in an office chair 8 hours a day and then sit in a car seat to go home and then sit in a lazy boy chair until you go to bed and then rinse and repeat. Your body's meant to do athletic stuff, and you should be doing athletic stuff. And being in good cardiovascular shape reduces your risk of almost every disease process you can think of, with the exception of obviously minor orthopedic injuries.
Yeah. That's a major statement. So what I'm going to do, I'm going to kind of lump a couple of things here, because actually we're going to keep this right at an hour here today, and that's awesome. So I'm going to lump some things in here together, because we've kind of talked about these things, and diabetes, obesity, and smoking and alcohol. Okay, so diabetes, people are more likely to get colon cancer because of diabetes if they have diabetes?
I think that is correct, but again, I'm not 100% sure, and I hem and haw about a lot of this because, for anybody who doesn't know, I'm a pediatric cardiologist. So between being a pediatrician and specifically a cardiologist, colon cancer is exactly 0% of my medical practice, but it's a common issue. And I have
but you know so many things. That's why I have you on.
I actually have a relative, my grandfather, my late grandfather died, not directly of colon cancer, but he got colon cancer towards the end of his life. So I'm fairly familiar with it from that standpoint. And because it's so common, it comes up in medical school and things like that. But diabetes increases your chances of almost everything bad. And I know that sounds pejorative, but it's just true. If you look at the potential increases of other disease processes from having type 2 or even type 1, but especially type 2 diabetes, it's very significant.
I'm sure that the COVID-19 probably has attacked the diabetic community probably pretty hard, would you say?
It's one of the pre-existing conditions that's pretty high in the list of things that has been associated with much higher morbidity and mortality.
Yeah.
And then, especially type 2 diabetes, the stereotypical type 2 diabetic is usually also overweight, and being overweight is also a major problem with COVID. So those two things travel together. So it's not surprising that you see them as being a significant comorbidity for
The
problem
smoking,
with coronavirus.
I'm sorry, the smoking and the drinking part, is that just more so because it just tears down certain organs in your body, or what
Yeah, so it's not 100% clear. So it's probably a combination of things. So, smoking in particular, you're going to end up having worsening lung function. Your chance of being in really good cardiovascular shape if you're smoking is less, both because if you're smoking, and you don't see a lot of people at the gym working out for an hour and then leaving and smoking. That's just that those two things don't typically go together, at least these days. And then there's some direct vascular changes that take place as an effect of nicotine that increase your risk of all sorts of issues with the cardiovascular system, and having poor blood supply to the colon and the other internal organs can affect their function, which can then lead to other problems. And you're also introducing a whole bunch of chemicals into your body, and those chemicals can increase your risk of all sorts of cancers, lung cancers directly, and most other cancers as well, because they get distributed throughout the entire body.
Okay, boy, some great information here today with you and with Christy Fix. But okay, so if we can sum all this up, what are the doctor's orders right now for someone who might think that they have it, or even if someone's going through it? What would just give us some of your final advice here for how to prevent colon cancer?
So a couple things. First, make sure you have a primary doctor that you trust and have a good relationship with, and you see them on a regular basis. And two, be honest with yourself and be honest with your physician about symptoms you're having. If something's scaring you, like having blood in your stool, changing your bowel habits, abdominal pain, sudden fatigue, talk to somebody about it. Tell your spouse, tell your significant other, and most importantly, tell your doctor, and get it looked into. And then, and Christy did a very good job of bringing this up, but if you have something that doesn't seem normal to you and you get it checked out and they tell you everything is fine, but you still have doubts or you're still having symptoms, like they say, oh, the blood in the stool is nothing to worry about.
Right.
But you keep having it, keep pushing and keep getting it looked into until you're satisfied that everything is fine. That little voice in the back of your head that's telling you something might be wrong, it's not always right, but I think it's always a bad idea to completely ignore that voice.
She actually made the comment about who literally follow your gut, right? It's a very, very awesome comment. Dr. Jon Lucas, I tell you, it's always a pleasure having you on. And I'm looking forward to this new series that I'm doing with a new format. And I wanted to change that up a little bit from just because people are getting confused. They're saying, why is a Muay Thai guy or a kickboxing guy talking about all this other stuff? Well, I'm more than that, right? And I'm interested in more than that. And I have people around me like you who are true professionals who can advise people and help people. So why not just expand the platform, right? So we can help more people. So I'm always appreciative of you, being a part of what we do. We're getting ready for the East Coast Classic, coming up in next month with the COVID-19 protocols and everything. Really quick, what are your thoughts? I've done 3 PKB tournaments. You see that I'm following protocols, masks, gloves, and everything. What are your quick thoughts on that as we close out today's show?
Yeah, so we've talked about this about the protocols and about doing those shows, but I think that with doing the masking, doing the temperature checks, keeping the crowds down, practicing social distancing and things
Right.
like, I think that it's perfectly appropriate to move forward with doing both the PKB shows and the East Coast Classic. And you see a lot of other sports leagues, like my son plays high school football. That's as of now anyways, that's good to go. They're doing their practices. They're not seeing huge spikes in the kids that are involved in the football team. He's back. The school he goes to has been back to school 5 days a week. They have the kids wearing masks. They're doing temperature checks, but they've not seen a huge increase in cases. And fortunately, in the upstate, the Greenville area, but across the state as well, the state of South Carolina, the number of hospitalizations and ICU beds and the number of positive tests has been heading in in the good direction.
In the good
The
direction.
number of hospitalizations has gone down
Right.
significantly over the course of the last month. So I think that masking probably has a lot to do with that.
Yes.
But if people are willing to take the very simple step of wearing their mask while they're at the arena, washing their hands, and being honest about symptoms. If you're sick, don't come. If you've got a cough, don't come. If you've got a fever, don't come. That's straightforward. You should always do that, but especially now
Right.
we have this pandemic going on. And I think that we have a great opportunity to have a good event and to do it safely. And I mean, and you've proven that. You've done what, 3 PKBs?
Three.
Yeah. And so far, 0 issues. And
Zero.
could somebody get coronavirus? They could, just like you can get it going to the grocery store, going out to eat,
Right.
going to school, all the other things. So.
Right. Well, we definitely recognize the opponent, right? We respect the opponent, right? But always respect your opponent, right? But forward march. Dr. Jon Lucas, thanks so much today, sir, for coming on the show.
Thanks for having me, Johnny. Always a pleasure.
Yes, sir. Bye-bye. All right, ladies and gentlemen, speaking there with Mr. Jon Lucas, they're always giving great advice. As always, I want to thank everyone for watching Johnny Davis Live. Again, we have our new format. We're going to be talking about a lot of different things. I hope you will join in on the show. If that show is not for you, check in the following week. Perhaps it will be something right up your alley. As always, we want to thank you for watching what we do and supporting our events and our shows and all of the things that we have going on with Johnny Davis Live and AK Promotions. I want you to be safe this weekend. Right? Be sure to wear your mask and respect other people. Always forward march. This is Johnny Davis Live, and I'm checking out. Talk to you soon. Bye-bye.